our meeting. So what I want to talk about today is mainly the tool that I sent out to everybody. And what is it feasible? I wanted your comments. Is it something we can work with? Or for your campus, is it going to work? I know every campus is different. So let's see what we can do though. So when we look at the tool, you know, the good old SWOT analysis, right? Strengths, weaknesses, opportunities, and threats. You've probably heard that before. When you look at the tool, or when you look at your simulation for your students, think about what's strong about your simulation, what you like about it, what works well, what helps the students learn. And then what are some weak areas? What do you think are hindrances to student learning? And then maybe you have ideas how you want to change things or how it would benefit the students. And then, of course, we have to look at what the obstacles are. And of course, there's one obstacle I already thought of, and that's schedule. Okay, so let's talk about this a little bit. First of all, I just want to get your ideas on the tool. What do you think about it?
Annie, was I included on that? I don't remember seeing this.
Oh, you know what, Lorraine, I probably neglected. Let me pull it up. Let's see here. I will definitely get it sent to you, okay? So this is the tool itself, the beginning of it. I just took, if you notice the top, campuses that have the 9 hours of simulation, and then there's 15-hour simulations in some and 30 in others.
Yep.
And I just went across. And what I put in here was what you have currently as far as your schedule for simulation. And then I put in what we were learning and talking about during didactic class. And then I made some suggestions in that far right column of things to kind of, and this is probably some things you're already doing. I don't mean to be offensive to anyone to tell you what to teach, but these are some suggestions that we came up with as a team. And so if we can better coordinate what we're teaching online to what's going on in simulation. And I know does everybody use the SLS program? Yes, I think so. Nobody uses anything different, right? Lorraine, you know that, don't you? Everybody
well, I know what we have available, but I don't know what's being used on campus necessarily.
Okay. As far as I could tell from the syllabi that I received from Darlene.
Correct. That's what I know, that according to according to the syllabi, that is
yeah. So when you for example, in week 3, some campuses have their first simulation, and during week 3 we're talking about labor and delivery and pain management, electronic fetal monitoring. A lot is going on during this week. So simulation basically needs to talk a lot about labor and delivery. I don't know if the SLS program has labor and delivery in it. Do you have a labor and delivery simulation?
Penny?
Yes.
I have a question.
Yes.
On campuses, are they doing the actual simulation, or are the students on the point resim?
Well, I think there's probably a mixture.
Okay.
Yeah. And that's why, you know, when we have these meetings, it's good to have
Mhm,
the deans and Lorraine
mhm.
involved, but we also need some simulation instructors in these meetings, and that would help.
Yeah,
That
yeah.
would help a lot. So that's one of my goals, is to try to communicate with the actual simulation instructor. I think that's who needs to kind of look at this as well. So I was hoping the deans was sharing this
Mhm.
tool with their simulation.
So I do teach simulation, and
Okay.
I do not use the vSim. We do actual in-person
Okay.
simulations. I do not believe, if, and I could be wrong to this because this is only my second term teaching this, but I don't believe that there is a like normal labor kind of thing. And I could be wrong. I have to go back and look at all of them. And it could be just because there's not one. But I know there's like hyperemesis. I know there's
Right.
preterm labor and all that kind of stuff. I do like normal labor stuff with them. And I
Okay.
also have them because our students don't get to go to clinical at all. So we actually watch, a live birth and a live C-section because, obviously doing it in there, but seeing it, even my students that have had their own babies, when
They
they
should-
watch these videos, they're like in shock. Like even like a C-section, like they just, it kind of helps put that together for them because they don't,
Yeah, yeah, yeah.
it's different
So
on the
they,
other side.
right,
And I
right.
can speak for here at Fortis Columbus. We do also have simulation. Unfortunately, that instructor I think is in clinical today, but I'm a clinical instructor and I also utilize videos. I like to hear that you're doing that as well. I find tasteful but realistic videos, vaginal birth with epidural, without, and then a C-section of twins. So it is definitely different. I always say at the other end, even if you've had kids. So I do utilize videos with my students, and we do on-site simulation as well.
Okay, good.
Okay. Good, good. Remind me, Devin, what campus are you from?
Cincinnati, sorry.
Okay, that's okay. Okay. All right. So Lorraine, from your viewpoint, is it possible, if the syllabus says, that, the schedule is on week 3, hyperemesis and preeclampsia, that is changed to something different? Or do they have to stick with that current schedule
Well,
on the
the
syllabus?
campuses have, like, the week that it's taught in has been a flexible thing. We haven't
Okay,
prescribed it just
okay.
because there's too many specifics per campus to work out, like, sim
Okay.
space, instructors, other courses, and whatnot.
Mhm. And I know the Lippincott, the point, I don't remember them having anything on labor and delivery. I know in the text that's associated with the VSIMs, the Lippincott, the point, there are a lot of different options in the text itself that could be utilized too. Because I have a copy of it, and they do have normal labor, and they use the unfolding case stories, and they have abnormal labor. So I don't know if that's something that can be utilized on campus or not. There's a lot to think about in this, and it's a huge project to evaluate. Because hyperemesis we don't talk about till almost the end of the quarter. Preeclampsia not before week 5. So doing those simulations at that time, we don't support them, we don't teach it prior to that. So that would require that you taught it during the simulation. And just instead of focusing maybe on epidurals, or electronic fetal monitoring or positioning during labor, things like that. So it just seems disjuncted. So what are any other thoughts from anybody? Danielle, Susan, Diane? Anything else?
I just tuned in, so I'm just kind of following along.
Okay, okay.
Sorry about that.
That's okay, Diane. I'm glad to see you.
I just want to add, this is a great tool. It kind of collaborates our teams together, the on-campus and online classes. And that way, the students, when we, and I'm further into the weeks, but when we're talking about postpartum hemorrhage and a boggy fundus, if they don't know what that is, or if they haven't put their hands on it, it's difficult to explain and for them to conceptualize. So I think when we can collaborate, this is what we're teaching in the didactic area. If you can at least look at it and see if you can coordinate your simulation, or at least kind of talk about Leopold's or practice that we're using, it will be helpful for that student to conceptualize what we're talking about.
Yeah.
Yeah, so one of the things I'm in the process of making, I've been working on this the past couple terms, and hopefully we'll be putting out for this term, is kind of a list of like maternal terms, and maternal meds and stuff that I'm going to have them do at the beginning of simulation, because that is one of the struggles that I always see with students. I always tell them maternity has its own language, and they struggle with that on test. And I think that's part of the things that once they overcome, because usually by about week 8 or 9, they start to feel comfortable because they've learned more of the language. They're able to talk more, that kind of stuff. So I'm trying to work on this to get them so that hopefully at the beginning, they're comfortable with these meds. They're comfortable with the names. They're comfortable with some of the terminology that we use, instead of waiting, I don't know, until I feel like, so for some students, it may be too late. So that's one of the things I've kind of been working on and pulling from, like, obviously the textbook and the chapters and simulation stuff that I've been using, and just kind of been gathering. And hopefully I'm going to be putting out this term for them to see how this works.
Yeah.
Because
That's
I
good.
think that is just one of the things that I see, and I hear not just from like from both parts, because they'll tell me they knew stuff for the test, but they didn't understand what the question was asking because they didn't understand the words. And, and I tell them that's part, I tell them on day 1 of simulation, they have to know them. And when they're reading, they need to make sure that they understand those terms and stuff. But, so I'm hoping that will help. And my other question is, have we ever looked at teaching? Because this is the only, I've taught maternity several times in several different places and lots of years. And it just, have we looked at teaching in like where we teach all of prenatal, all of labor, and then go all of newborn, like in the theory part? Because I feel like students are struggling with kind of going back, like the back and forth.
Well, although, so the NUR RN program does do normal first and then go back and do high risk, which I think has a benefit to it because it reminds them what they've learned. If we say this is what's normal, now we're coming back and saying this is what's abnormal, they're having to think through those concepts. In the PN program, it does do it all together a lot more. But either way, that part of this, we don't have a say in. It flows, this is that part of the class and the way it flows and which chapters are in the syllabus for which week and so on and so forth, that was predetermined. And so to try to make that kind of a change would be an enormous undertaking that would change the entire curriculum. And when I have taught both RN and PN and I see the differences, I don't think that ultimately it makes that big of a difference in their level of understanding. If nothing else, I do think that going back and learning high risk after you've already learned normal is kind of a benefit, because otherwise they don't think about certain concepts again in week 10 that they learned in week 2 or whatever, if we aren't talking about high risk as a separate category, if that makes sense.
So my only input on that is that we need to remember the scope of a PN in the PN program. And keep in mind, like the NCLEX test plan and the client needs categories and activity statements there. And if we're teaching beyond that, then we just don't have the time to then teaching beyond that. And keeping, like I said, keeping in mind the scope of what a PN program needs to have for, which is different for the RN program.
Oh, yeah, absolutely. Because we're using the same simulation. So you have to run them differently. Like I teach RN and PN, and so I have to run them differently based off which group I'm
Off the
doing.
scope, yes.
Yeah.
Yeah, off the scope and which group I'm doing. And I have to tell them, you know, this is, yes, and how, what their role would be in this situation, because it's different. Yes.
Absolutely. So again, going back to the NCLEX test plan and using those activity statements to guide that is like a best practice.
Right.
I think that by bringing, since we have both RN and PN in this collaboration, I was mostly just bringing it up to show that in the RN program, we do all normal and then go back and do all high risk. And in the PN, it's more of, this is all of pregnancy, normal and abnormal. This is all of labor, normal and abnormal. This is all. And even though they're lumped and taught a little bit differently, I don't necessarily see one as being an advantage over the other.
Well, all I can say is, well, from here currently, I can say is from a simulation perspective, because all of our simulations are almost pretty much abnormal. So I have to figure out how to, so I have chose this last term to teach it in a all prenatal, all labor, all newborn perspective. And my students did so much better, and their dots connected, and they felt they did so much better. And their HESI score, like everything. And they kept saying simulate if it wasn't for simulation. And I feel like that's the only reason I was asking. But, and I've just, you know, because
That's
I
good
just,
input, Devin. I think that tells us a lot. But it sounds like you really have a good grasp of that, and that's huge too for your students. Your students are feeling that support, and so that means you're doing a good job.
no, thank you. Trying.
Yes. Even my one Cincinnati student didn't pass. I had two, but my one didn't pass, so. Okay, so we've talked a lot about, there's a lot of opportunities here for improvement. We might not be able to change the simulation schedule, all at one time, but if we're thinking along those lines, you'll begin to probably recognize ways of implementing those important concepts of labor and delivery and, pain management, that week 3, that everybody has a simulation. What really needs to be focused on, like hyperemesis. Yes, hyperemesis does occur early in pregnancy, and it can occur throughout pregnancy. But we usually don't talk about it early. But it's also a good med surge simulation, hyperemesis. So it does coordinate with med surge. As far as preeclampsia, that's just so beyond where we are, because we haven't even talked about, anything about high risk, much of anything in week 3. We've mentioned preconceptual high risk concepts, but not labor and delivery antepartum high risk concepts. So that one I'm not sure about. So at least going back to the drugs, all of the OB didactic instructors give out list of drugs at the beginning. We posted in the announcements all the drugs used in OB. They're nicely laid out in our textbook. Indications, contraindications, what you need to monitor, and it's really good in the text. But I still find that the students, I know that they're required to do drugs for simulation. But there are times towards the end of the quarter when they still don't know their drugs. There's really, and I have to remind them often, have you made a drug card for prostaglandins? What do we use them for in OB? So that's one thing we really need to reiterate. The drugs, they need to know their drugs.
Also, Penny, in Saunders' PM book, the last chapter in the maternity section has a great medication for the mommy and the baby. And it's laid out beautifully, easy to read. And so I even go over that with them. So that they get their drugs and understand it, because I know in sim we had the drugs, because I taught on campus and I did simulation for both
Me too.
programs.
Yeah, they had to know those drugs.
Had to know those drugs so that they know what was happening with the patient, if she was in preterm labor, or she was in labor, she was having pain, whatever. They knew the drugs.
I do want to make a comment kind of on the side. My HESI scores for my OB students were better this quarter than they've been in a long time. And I have to just, even those students who struggled, Salt Lake City, Mr. Rock, I was so proud of Salt Lake City and how they progressed. They did so well on the HESI, and it gives me goosebumps.
We spent a lot of time actually, and I mentioned in the comment, but we spent a lot of time on terminology, because I was starting to do a little bit of tutoring, and that's what I found out that they were struggling with too.
Great. Okay.
And so I think it really made a difference that I don't know, I like that idea. I appreciate that they get the drugs. They failed to mention that when I spent time overviewing all those drugs, but yeah, that they have that document. And if we introduce something that also included the terminology, I think that would round it out.
Yeah, like Devin mentioned.
Yeah, it was Devin. Okay.
Yeah.
So Devin, if you don't mind sharing that would be fantastic. I feel like I should trade you something for it, but I don't have anything.
OB didactic instructors, Danielle, I don't know, Susan, or Adele, any of you here, that might be something we could include the very first week after orientation, is maybe implement some kind of game or something.
I play a terminology Kahoot game oftentimes after like an exam, when their brains are kind of fried and they're not really gonna dive into new information.
Yeah.
Okay.
Anyway, yeah, I had to reteach myself all of that terminology before working with them. And but yes, I just wanted to say that Salt Lake in particular, we have really noticed a difference in their engagement and how much they've been able to learn as compared to the previous couple of quarters. It was really that was a great quarter for us here. Thank you.
Yeah, thank you. When you have to learn with the students, they really appreciate that. They're more teachable at that point, I think, if you have to work with them. Okay, any other comments?
I don't have a comment, I have a question. Do we know when Elsevier is going to match their practice exams to the next gen?
Practice, you mean when they have to go in and do a practice test, practice exam? No, yes, I don't.
Because I know for most of my students, I know Adian, at least, this was their first next gen test. And when it opened up and they saw how the questions were, I thought they were going to fall out of their seats. I was going to have to resuscitate a few of them because they weren't used to seeing them the way, just how they had to highlight things and that kind of stuff. And so that, that group, most of them did really well still, because I just told them, I said, take a breath, remember what you've been taught, that just trying to calm them down. But that just really threw some of them off. So I just didn't know if we had a date of when they're going to be able to have access to those particular types of questions. And I was going to work on like next term in sim, having them like giving them, you know, like more of like the background and then like the report sheets and having them highlights, like try to work on that stuff in sim, but
Yeah.
they just really like it threw them off. So I asked them about their practice and they said their practice was just like regular questions. It wasn't anything like that. So I just didn't know if we had any kind
Are
of,
you talking about the HESI practice test?
yes, ma'am. Yes.
Okay, okay.
So Elsevier is working on that, but we're also working to put more next gen style questions in our unit exams. We're a little bit limited with ExamSoft and the style of questions that are available. Like there is highlight, but it's not really highlight within text type of highlight. It's like highlight a picture. And the same thing, like there is like a case study type thing that has live tiles that they have to look back and forth like they're looking at a nursing chart, but it's not exactly what they see. There's not a bow tie option. There is a drag and drop. So we're working on that, and when we get our item writers to help us start building up our exam banks, then that will be a priority. So
Okay. No, I'm obviously, because when I saw that, I'm going to try to do some things in sim to kind of help with it, but I just didn't know if we had a.
Well, and I don't know if you're aware of the scoring on the HESI, and I don't know that I would advertise this to students because then they don't try, but the next gen style questions are not included in their score
Right, yeah, they're not.
right now.
Yeah, more of a pilot study.
Yeah.
We are doing that in the didactic classes, Devin. I know a lot of us are doing like case studies. And when I do a case study, you know, I use a PowerPoint and they read the case about the client, what's going on, the setting, what cues do they see that triggers their mind. And so, you know, I highlight as they talk to me. And so we do implement some of the highlighting. And then I know Danielle and myself, I'm not sure about the other instructors, but we are beginning on Zoom to use the whiteboard. And there's just a lot you can do on the whiteboard by the drag and drop. So we are slowly getting that into the didactic portion, so won't be so surprised when they get actually to the HESI.
Okay. I was just wondering, because like I said,
Yeah.
I'm trying to, I did a Swift River with them this time, like an in-class activity. And it was really good because I had like them come up and use the mouse, and I had them work as a class and answer it. And so they would talk about it, and somebody would be like, well, I think it's A, or I think it should be 1462 or whatever. And the other one would be like, well, I think it should be this. And then I would tell, then they had to talk about why, you know. And I told them they're not getting graded on if they get it right. It's that the thinking and the critical thinking and why and talking through and all that kind of stuff. And then afterwards, when the answers would come up, then we would talk about it. And some of my students really loved that. Like I had like a couple students that come up to me afterwards and said, can we do that again? Like they got so much out of it. I'm like, well, I only have so much times during the week. So if I have, depending on the group, if I, get through my simulation instead of like, I'll pull this kind of stuff up. But I will tell, if anybody has time that they need to fill, if we still have access to the Swift River, I know, which is very limited, but it was a really good activity for them. And, the delegation, and I was trying to link it back to the test plan, and it shows like some of the different like safety and that kind of stuff. It shows delegation because it keeps popping up, and they kept saying this little pop up, and I'm like, well, let me explain this and how this works for NCLEX and that kind. And it brought on a whole new thing for them or whatever. So that was something else that I did this term that I hadn't done just because I had some time one day to fill, and I wasn't going to let them go 2 hours early. So
yeah. So that's great. The ideas that you have, Devin, if, you come up with some things and you make a list of things, and have, give it to Michelle and let's distribute it if that's something you're okay with.
Oh, yeah,
So that some of the other simulation instructors can also do that.
Okay, I can do that.
Yeah. Or you can share them with me. I really like during class to ask the students what they're doing in clinical. In simulation, I don't get a lot of input from them. And part of it is because I don't really know who's doing what and when. So I just have to ask them. I wish I did. I don't know how feasible that is to know where everybody else is doing what. I don't know if that's necessary, but
Well, and you'll probably get answers like I do when I ask what they're learning in class, and they'll tell me nothing. Yeah, right.
oh no, they don't learn anything in class, do they?
Nothing for 3 hours, nothing. Yeah. I'm like, that's because you're not paying attention. If that's
Right.
your answer, that's on you, not, yeah. So
Thank you.
Or they're not preparing before class, because in OB they have to take their KGA quizzes before class time, and there's 2 questions on the 10-question quiz based upon the current what we're teaching that week. So they do have to be prepared when they come to class. So okay, good input. Anything else you see that might help improve student outcomes? That's our ultimate goal. I think also I'm going to take some time to look at the clinical judgment results from the HESI to see where they are. I did notice a difference between my sections, and of course my sections are all different campuses, but some of them did much better on clinical judgment skills than the others. And it's not necessarily the ones that did well all quarter. Some of the ones that struggled all quarter, when they did their HESI and they performed well. Mackenzie Rubio, is she at Salt Lake City, John? Okay, she did not do well all quarter, but she did super well on the HESI. And not only that, her clinical judgment skills are pretty good compared to someone who did well. And so that's something to think about. So in other words, she can do it. Okay, so looking at those
I don't know what
and
to tell you.
evaluating. What?
I'm a great tutor. I don't know what to tell you.
Yes, it's something else.
It oozes out of me the confidence in the clinical judgment. No, I don't know what it was, but I'm certainly going to be asking some of these students what they felt it was and share that with you.
Yeah, definitely. Please, and let me know. Yeah. Okay. So I would like to meet again this next quarter, earlier rather than later in the quarter, to talk about those clinical judgment skills. If we notice any trends and think about, maybe how we're implementing those in our teaching. So I would like to meet again before maybe week 3, before we actually start at-risk stuff. Is that going to work for anybody?
Just Penny, just put it on the calendar and I'll make it work. It's fine.
Okay. So week 3 on Monday.
Yeah, I'm just going to throw out that I'll be gone all of week 4, if it matters at all.
All of week 4. Okay. All right. Okay.
Somebody holding
All
a baby.
right. So Emily, what's going on? Who's Emily?
Hi, I'm Emily Wilford. I'm in the
Okay,
Cuyahoga Falls.
that's who I thought it was.
Yeah, Cuyahoga Falls simulation instructor
Okay. All right,
and lab
yes.
for the PNs.
Okay. Good. Well, unless we have something else to discuss, I think we've had some good conversation, and I really do appreciate all of the input. I think in the long run, it's really going to help OB students and just the program. The better we communicate together with you on campus, the better we'll be as a team. fully convinced of that, and I appreciate it.
Penny, is there
Yes.
a list of everybody's like name and what they do and their campuses?
We try. I know Deb, I think Deb Northrup tries
I
to do
know,
that. reporter.
yeah.
I
Okay.
have several, yeah, I know, Salt Lake City, John, Rock I have their list of their people. They've been really good about telling me who that is. So on the at-risk reports, my templates, I think I include just about everybody. But I'll try to get that to you. It should be on SharePoint, Irene.
Yeah, I think
Okay,
it's on
Under campus
SharePoint.
campus contacts.
okay, I'll look on there. Yeah, because I like to keep in touch with the campus's simulation and clinical instructors. Sure.
Yeah. Oh, yeah. Me too. Me too.
Yeah, because when I asked them, how they doing, did you put your hands on the well? Did you, did you feel the fundus, and they said, no. And so I go, okay, so it's just like, the sim teachers asking what they're learning online, nothing, same thing, but I
Yeah,
realized
yeah.
that. And so I like to be in
Yeah.
contact. Yeah. Thank you.
Yeah. Yes. And if you send an email out, to maybe to the dean and,
Okay.
get the name of, so you can get some input.
Okay,
From
yeah,
those people. Mhm.
yeah,
But yeah, I know there are several campuses that are really good about communicating with me.
Yeah.
They let me know, especially when I send an at-risk report out to all of them.
yeah,
I get some feedback, and that does help.
okay. Good to know.
Okay.
Okay, thank you all.
Everybody, for coming this morning, and I appreciate it so much. I'm excited about what we have to look forward to and to improve. I had a good quarter. I don't know about you all, but I did.
I did
was-
too. It was
We had a
great.
lot of changes. But I think there were changes towards the good. So anyway, thank you so much, everybody.